everyone. Welcome to our webinar today with Dr. Aviva Romm. We're talking today about the truth about adrenal fatigue. And for those of you who don't know Dr. Aviva Romm, she is a midwife, an herbalist, and a Yale-trained MD, board certified in family medicine with obstetrics, who has been bridging the best of traditional medicine with good science for over 3 decades. Her focus is on something called total health ecology, utilizing exposome medicine. Am I saying that right?
You are. Exposome medicine. Yeah.
Exposome medicine to help identify and reverse the root causes of chronic conditions, particularly with hormonal problems and children's health problems. And Aviva is considered one of the world's leaders in botanical medicine and has authored 7 books, which is crazy. And you're working on another one right now, right?
Yep.
Yes. Yeah. So excited to see that one too. But you've written a book about botanical medicine for women's health, and of course the one we're talking about today, the Adrenal Thyroid Revolution.
Yep.
And you're the author of the Integrative Medicine Curriculum at Yale for their internal medicine and pediatric residency program. Is that right?
Yes, it's true.
Yeah, and numerous scientific advisory and editorial boards you're involved in, and you've done public speaking at conferences. That was something where I saw you at for one of the first times, and I guess, you know, you're also doing online programs for women that are wildly popular and successful, which help women take back their health in an affordable way. But you're also doing innovative professional programs too that are educating like new generations of health practitioners to help.
That's my big passion right now. I have to tell you, it's like the biggest question I get in my inbox every single day is, Dr. Aviva, can I be your patient, or where do I find someone like you? And it's such an honor, but you know, I couldn't practice enough hours to meet the need out there, and it can't be one practitioner. So it got clear to me a few years ago I needed to really start training other professionals to feel confident in meeting the needs of the kinds of women that were writing to me. So that is like my love child. my courses are my love child.
Amazing. And somewhere in there too, you're doing a nonprofit organization where you're helping fund obstetric programs and midwifery education. And
yes. I mean, Fullscript is a huge part of this. So part of what I have made a decision about in my own online presence and my own courses is to be able to provide information in a way that nobody who ever is coming to me feels like, whether they're coming as a patient or as a student or just coming to my website or podcast, that they ever feel like there's an ulterior motive behind the information. And that, you know, you go to a lot of health celebrity websites and you'll see an article about something, and then the next thing you see is their branded supplements that you have to buy to do what's in the article. And so we, meaning my husband and I, he helps me run the business end of things, decided to never take any profits off of supplements. And so, but yet people ask me all the time, where can I get supplements? Where do I get supplements that you use? And so what we did was we created an online portal. They're not paying me to say this, you guys. I'm just saying it because this is what we do. We created an online portal basically as an extension of my patient portal that people could access the Fullscript account that I've created that they create for themselves, but that I've set up the inbox for and the catalog for. And then we give all consumers a 20% discount, but then we take 100% of all profits and donate them to organizations that are working to reduce maternal mortality in high-risk women, so largely in the African American community in the US and in developing countries. And it's just been amazing it's been so fulfilling and rewarding. And then everyone who's buying their families supplements or supplements for their practice can also feel like they're participating and really making a difference.
Yeah, that's awesome.
Yeah.
And somewhere in there too, you're doing a podcast called Natural MD Radio. Yeah, which that's more patient-centric, is that correct?
You know, I would call it prosumer level in the sense that my audience tends to be a relatively well-educated, knowledgeable health audience. And even the women who are health professionals in my community, they don't always want things that are sort of over the top, you know, academic. They want something that they can also enjoy listening to while they're on their bicycle or, you know, in the car on the way somewhere. So I try to reach kind of like a high level for consumers, but also still really relatable for professionals. So it's in the middle there.
Yeah. I've listened to it and I think it's great. And I do recommend people to to it too, because it's just another way for them to continually hear more and more about the things they can continue to do to improve their
Yeah,
health.
and audio is such an easy way. People don't necessarily have time to sit and read a long form blog. So I'll do the audio and then I match it with a long form blog so that people can go back and, grab the information if there were facts or doses of something. And then I also interview other people, just trying to keep it really interesting. What's going on in women's health or children's health. Like I just did one on what you need to know about the measles if your kid, like stepping away from the vaccine debate and saying, if your kid gets the measles, here's what you need to know. And I just did one on everything you need to know about HPV, PAPS, and pelvic exams. So, it reaches kind of the professional audience and the general audience.
Yeah, that's awesome. And so
Yeah.
today we're talking about adrenal fatigue, of course, and it's a really popular diagnosis. So many of us have been using it for years, but you raised this question, like, is it a real thing? And why is that? Let's talk about that a little bit.
Yeah, so I think that there's two kind of issues going on. One is that there is a real phenomenon. People are burnt out, overwhelmed, exhausted, having cortisol imbalances, whether too high, too low, not having a good morning cortisol awakening response, jacked up at night and unable to go to sleep, and then all of the physical downstream effects of that. And that is actually a response that's happening in the whole stress response system with the adrenals pumping out ultimately cortisol and adrenaline. The problem is, well, two things. One, it's not truly the adrenals that are getting fatigued. The adrenals usually keep, unless you have an adrenal disorder, like a medically diagnosable Cushing's, or one of the adrenal diseases, the adrenals themselves aren't pooped out. What's really happening is that our bodies and our brains, not really separated, but I'll kind of talk about them as a little bit hierarchical there, are in our brain's infinite wisdom to protect our body from harm. It's actually the brain that says, well, we need to put the brakes on the adrenals. So adrenal cortisol in the medical world, and many of you have heard this term, is called the wear and tear hormone. So it's a survival hormone. It's the one thing we just really can't live without. And for a very short time, very low cortisol can really take you out. But over time, too much cortisol exposure can start to truly, literally wear and tear on your body. You can get muscle breakdown. You can get higher bone turnover and osteopenia or osteoporosis. You can get chronic inflammation that has an impact on physical structures. You can actually get frontal cortex neuronal remodeling that can lead to what we commonly call brain fog, but actually is changes in willpower and cognitive function and organization. So this is a real phenomenon that's happening. But one, as I said, there are two things. One, it's not the adrenals that are fatigued. It's the brain saying, we can't let this person run on fumes forever. So the brain says, we're not going to keep stimulating the adrenals. And so the adrenal stop putting out as much cortisol and stop putting out as much adrenaline. The second thing, and the reason that I really want to emphasize that, because that's to some extent semantic, we know what we're talking about when we say adrenal fatigue. The real issue that I get concerned about is when we give a patient a diagnosis of adrenal fatigue, particularly if you are not that person's primary care provider or endocrinologist and they're seeing other practitioners, and they go to that practitioner, that licensed MD, and say, I have adrenal fatigue, this is what you get. Did I do that right? Did I do the eye roll? Could you see the eye roll? Now, no patient should ever get an eye roll for any reason. Totally inappropriate, totally disrespectful, and dismissive. But medical doctors are, on the one hand, trying to protect their patients from inaccurate, erroneous diagnoses, and two, just don't have knowledge necessarily of what this really means. And so when you give a diagnosis of adrenal fatigue, and that diagnosis then gets brought down the road to other practitioners by a patient, you actually increase the likelihood that that patient is going to get dismissed as it being all in their head or they're that kind of patient. And it actually doesn't really do justice to the integrative, functional, and alternative world to be giving out diagnoses that are more poetic in a way than actual. So unfortunately, we don't really have a terrific term that is sort of medically accurate and medically recognized. So in my practice, I usually use either functional adrenal disorder or adrenal dysfunction or disordered stress response. And then I'll explain it so that if my patient is also working with another practitioner, there's some understanding of that. But I think it also is important because when we think about adrenal fatigue, then we start to think, well, we have to do something to fix the adrenals, because we still sometimes, even when as alternative as we might be to the conventional, name it and fix it model, sometimes we fall into that too. And so when we think about it as just a problem in the adrenals, we're really missing a lot of other parts of the picture that can be going on. Things going on in the hypothalamus due to stress, trauma that has impacted the amygdala, that's gotten that stress response disordered, lifestyle issues, nutritional issues, blood sugar imbalances, so many other pieces that fit into that, as opposed to just, well, let me give some phosphatidylserine or let me give some ashwagandha to fix the adrenals.
Right, right. And one thing I loved about your book is that you coined this term survival overdrive syndrome, or
Yes.
SOS, which I think was so brilliant. Like, perfect. That's exactly
Yes.
what it is. Yeah. So,
and again, not a real diagnosis. So I do tell my patients,
of course,
it's a way of understanding what's going on. My patients, what I was finding was people were saying things like, Dr. Aviva, I feel like I'm always stuck in survival mode, or I always feel like I'm stuck in the on position, or I'm in overdrive and I can't turn off. And I was actually talking with someone about it, and I said, my patients are in this like survival overdrive. And she said, it sounds like a syndrome. And then we were playing with it, and then we realized it was SOS. And so we started using that in the book.
Yeah, yeah.
I started using it with my patients, and they loved it. And I was like, I'm just going to put this in the book.
Yeah, yeah. So, why is it so, why do you think it's so prevalent that no one has like made this change in the way we're addressing adrenals? Like, previously always calling it adrenal fatigue, and why has it taken so long for us to kind of get there to call it something different?
Well, I think we see this with a lot of medical conditions. We saw it for decades with chronic fatigue syndrome, which was largely a syndrome, a set of symptoms that women were experiencing. There was no real clear marker for it that doctors could identify. And of course, doctors are the ones setting the tone of what medical doctors, MDs, are the ones setting the tone of whether this stuff gets believed or not, right? And so there were no markers, there was no good diagnosis. It was largely affecting women, and it was largely symptoms like, I don't really feel like myself. I'm really tired. I'm really stressed. I'm not sleeping well. So a lot of these symptoms that have classically been dismissed as psychosomatic or hysterical or all in our head or whatever you want to call it. So the fact that and then we saw the same thing with fibromyalgia, right? And it hasn't really been until people have been able to start to say, oh, there's really some pathophysiology going on here. This is real. And PMS, I mean, even PMS wasn't acknowledged as a real medical condition until the last couple of decades, even though people have been talking about it for centuries, that women go through some changes in that time. And for some women, it's severe enough to be incapacitating. So we're in this situation with a medical model that if you can't diagnose it, it doesn't exist. And we even see, for example, with thyroid, particularly Hashimoto's or hypothyroidism, that we have diagnosable levels of testing that we can do. But you could have a woman who comes in, and this is often a phenomenon that is affecting women primarily, but it can be a man as well, or gender non-binary. I don't even want to pigeonhole anybody. You can be a human being with, let's say, a thyroid stimulating hormone that comes back at 4.6. You can be exhausted. Your hair can be falling out. You could have gained 30 pounds in the last 3 months, having a bowel movement once a week and anxious all the time. Your TSH is 4.6. If the lab cutoff is 4.8, you run a really good chance of your doctor saying, you're normal, it's fine, it's not your thyroid. So medicine is very black and white. And it's like saying that a pot of water at 210 degrees Fahrenheit isn't boiling. Well, technically it's not until it gets to 212, but if it's simmering and bubbling, it's pretty close, right? So you could throw the spaghetti in, and gluten-free spaghetti, right? We're going to talk about thyroid today. So this is really why we don't have a really clear way that the medical model establishes of saying there's this gray area where it's not Cushing's, it's not Addison's, but the person's also not just normal and fine. What's going on in the middle? That hasn't been established. And until that's established, I think we're going to continue to see this dismissed as a hokey diagnosis. I think the other complexity is with Hashimoto's, for example, if somebody has a high TSH and elevated antibodies, we can say, okay, that's hypothyroid and with an autoimmune component. But with adrenal imbalances, if you will, adrenal dysfunction, you can have so many different presentations of it. And even though, for example, a 24-hour salivary cortisol is a recognized established test, it's one that we're certainly not taught about in medical school, but there's so many different ways that can present that we don't have to sort of like, this is what it looks like, this is the diagnosis, you've got this. So we're in this gray zone. Medicine doesn't like gray zones.
Yeah, for sure. And so, and I know a lot of my colleagues in the US are using like ICD-10 codes, like just fatigue or just endocrine disorder, NOS.
Exactly.
Like, yeah. So what are you recommending then for other practitioners to use? Is that like ICD-10 code when
Yeah, I mean, I usually say pick the most dominant symptom and one that's not going to give a patient a label that they don't want. So if somebody's fatigued and they have some depression and they've gained some weight, I wouldn't put the depression as the primary if I can pick something else, just because that has potential stigmatization. So then I would just say fatigue. Fatigue is great because the one thing about fatigue as a diagnosis, it also allows you a wide range of testing that can fall into that. And there are a lot of other things that can cause fatigue and depression and so forth and so on. So for example, it gives me latitude to check for iron deficiency anemia. It gives me latitude to do anti-nuclear antibody and reflex testing. It gives me latitude to check for Lyme if I'm in a Lyme endemic community, which I am in my practice. If it gives me latitude to, I mean, really, there's so many things that fall under that fatigue rubric. EBV testing, Epstein-Barr virus testing. So that's a diagnosis I will commonly pick. If there's something that's more predominant, joint aches and pains, weight gain, then I might select that.
Right. And this being said, like there's so many implications that this level of adrenal dysfunction has on the body. It affects chronic disease development.
Yes, absolutely. It's huge. And I think, we give kind of lip service and acknowledge, even in the conventional world, that stress has an impact on our health. But when you start to get granular about it and say, well, what does that actually mean? And we all know, as practitioners, we all know that there are very few conditions that stress doesn't influence. And we also know that being unwell or frankly having a diagnosis also creates a stress component. So what does it mean when we say stress causes illness? Well, what's really happening on, aside from sort of the spiritual level, the adrenal stress response or the stress response system is getting activated. And what we're seeing as those adverse effects of stress are really the long-term impact of either chronic high adrenaline and or chronic high cortisol, or the flip side of that, when the brain says to the adrenals, enough is enough, time out, we have to put the brakes on, then you see the reverse, which is underproduction of cortisol and underproduction of adrenaline, and that can have other impacts. So for example, too much cortisol, as I mentioned, can cause a lot of that wear and tear, and also brain fog, but it can also cause true measurable cognitive dysfunction. The chronic exposure to high adrenaline, high cortisol leads to increased production of and release of glucose and glycogen and blood sugar stores, and with that increased production and release of insulin. And over time, that can lead to high blood sugar, insulin resistance, prediabetes, and even diabetes. There's a direct correlation that's really well documented in the literature between cortisol and diabetes. And anyone who's given a patient a corticosteroid knows that one of the things that we often have to do when we're treating patients with steroids in hospital is actually give them insulin temporarily because their blood sugar can become quickly elevated. That impact of chronic exposure to higher levels of cortisol can also lead to depression, or mania, much like a corticosteroid can. Chronic high adrenaline can lead people to become hypervigilant, anxious, unable to sleep at night. The impact of poor sleep at night due to both cortisol and adrenaline, just the impact of poor sleep at night can cause weight gain, sugar cravings, blood sugar imbalances. We know from studies that have been done on nurses who have night shifts that nurses who have elevated cortisol or circadian rhythm disruption as a result of their shifts have higher risk of diabetes, autoimmune disease, depression, and breast cancer. And these are all the downstream effects of high cortisol. High adrenaline, in addition to anxiety, causes constriction of the vascular system, so you can have hypertension. It can cause cardiac arrhythmias, and it can cause agitation. But then when you go to the other extreme, where now the body is producing lower amounts of adrenaline and cortisol, adrenaline gives us motivation, it gives us drive, it gives us excitement, it gives us a good feeling that we wake up in the morning and we do our work. It gives us that feeling of a little bit of pressure and stimulation when we're heading into a deadline that gets us to get the work done. And so when we take that away, you can have depression, you can have low motivation, you can have really a huge impact on a person's drive and willpower. And when you kibosh the cortisol, you can start to have pretty significant immune dysregulation, getting sick more often than usual, having a hard time with things like controlling herpes virus infection if you're a carrier, more outbreaks, reoccurrences of Epstein-Barr virus that's latent, and autoimmune disease. So it's really huge. And just the connection even between cortisol and the thyroid, there are actually 3 different target points where elevated cortisol causes downregulation of thyroid production and thyroid function. So it inhibits TSH, it inhibits the conversion of production of T3 and T4 in the thyroid, and it makes the cells more thyroid resistant, so thyroid hormone resistant. So huge, huge connections right there.
Right. And reproductive health too, right? There's
Oh
some.
gosh, huge. Yes, yes,
That's a
definitely.
big focus for you.
It is a big focus. I mean, I kind of treat the whole gamut, although these days I'm kind of starting to niche my practice a little bit more into women's hormones, including adrenal and thyroid, reproductive, because it's just, there's so much to keep up with so many different conditions. But absolutely. So when we think about cortisol as being the survival hormone, and when we also think about the effect of cortisol on the thyroid, which thyroid's control over reproductive function is huge, it's essentially like the body getting this big message that the environment isn't safe, and there's also not enough energy resource to go around to divide it to another human being. So in a major way, it's a kind of survival mechanism that your brain and body are saying, too much stress, something's wrong in the environment, something's wrong internally. We're going to shut the systems down and we're going to conserve energy. And one of the ways we're going to conserve energy is by not having this person be able to reproduce right now. So you can see little dysregulations in women's reproductive cycles with or without thyroid impact. Things like your period being irregular, more menstrual cramps, PMS. But then you can also see bigger problems. I mean, think about the correlation, for example, between polycystic ovarian syndrome and insulin resistance. So insulin resistance due to chronically elevated cortisol can be an underlying factor, for example, in the development of PCOS. Think about endometriosis. It's really, we think of it as a hormonal condition, but it's much more an inflammatory and immune dysregulation condition. And we know that there's a correlation between what's going on with cortisol and immune regulation and inflammation. So the kind of the list goes on. Uterine fibroids even, and shifts in insulin growth factor, and shifts in elimination of estrogen. I mean, it really starts to, when you look at where these little roots go, these little tendrils go into total health, it's not that everything that everyone's experiencing is because of the adrenals or because of the thyroid, but it's really hard to tease out where cortisol and adrenaline, and particularly cortisol, aren't involved in most chronic health conditions. It's phenomenal.
Right. Well, the whole body's connected, right? Yeah, it's super fascinating. But yeah, like the whole body's connected. It's one system. One thing happens, it affects something else. Like there has to be a change there. So it's not
Yes.
really surprising, but it still seems new.
It's, you know what I think is so cool is that when we kind of study medicine, and I think to some extent even with naturopathic medicine, we think about body systems, right? And in functional medicine, we're thinking about the gut, and we're thinking about the adrenals, and we're thinking about the detoxification system. It's a little bit more whole, but we're still breaking it down. And if you think about the body as an orchestra, and you think about the hypothalamus as a conductor, the the musical notes that are being communicated from the conductor to the orchestra to play are cortisol. So every single cell in the body, every cell except for red blood cells, is actually tuned to circadian rhythms. And every body tissue, every body organizational system is tuned to its own unique circadian rhythms. So we have different sets of immune cells that are active at night compared to in the day. Our digestive system is doing different things at night than during the day. Our brain, like our whole glymphatic system, is draining at night and detoxifying at night, very different than what it's doing in the day. And every one of these functions is tied into the messages that are coming partly through that communication of the brain to the cells through cortisol. I mean, it's so amazing.
Yeah, yeah. I love
Yeah.
that analogy of the orchestra and the
Mhm.
conductor. I'm definitely going to be using that.
Go for it.
Yeah. Okay, so you've got so much going on in your life, and you've had
Yes.
a professional life through having 4 kids and doing all of this stuff that you've done, and somewhere going to medical school in there. Like, it's a lot. So of course you've probably had your share of stress, and
Definitely.
practitioners, we all do too. And so what do you recommend practitioners do to help make sure that they don't get fatigued, that they don't deal with some of this survival overdrive syndrome?
It's so huge for practitioners. I mean, what's going on with burnout and suicide rates and depression and anxiety, practitioner fatigue, compassion fatigue. It's sad and it's scary. So I'm a huge proponent of self-care. And I'm also a huge proponent of walking my talk. So just like everyone else, I have times that get much more busy and times that are a little bit more of a lull. But I've gotten really good at building self-care into my own life. And so, for example, this is a really funny story. I had a woman who came to do some photographs for me for my website, and she wanted to make the photographs look like I was out there in the world doing my real life stuff. So she wanted to go to this cafe, and so she had her assistant, and she wanted it to look like I was having tea with another woman. So she had the assistant sit down at the table, and I sat down at the table, and she said, can you guys hand me your cell phones? And so I went in my bag and I handed her my cell phone, and she put it on the table. And I said, what are you doing? She said, I'm trying to make it look like you're having a real conversation. So your cell phone's on the table. And I was like, actually, you would never find me out with any human being unless I was like on the edge of waiting for someone to go into labor, maybe. I would never have my cell phone out when I'm in communication with other people. So I start with cell phones. It's a really good place to, I think a lot of us are much more actually physiologically addicted to technology than we might want to admit. So starting with your cell phone in the morning, don't let yourself look at your cell phone until you have gotten out of bed and done some aspect of self-care for yourself. That can be grabbing a shower where you're just decompressing, letting the night wash off over you, saying a kind of nice visualization or setting an intention for the day, sipping your tea, or if you drink coffee, sipping it slowly, not like, I've got an empty cup here, but not like, you're doing that, you're on the dashboard, you're doing 15 things, stirring the oatmeal for your kids and trying to get out the door. So a much slower pace. And then really try to stay off of electronics as much as you can throughout the day, because I'm finding that what's partly happening is people are so distracted and it's amping up their stress level. And then similarly, having a wind down practice at night where an hour before bed, no electronics. I mean, if you're watching Game of Thrones, I get it, you have to use your electronics, but even there, try to get off of all electronics and TV at least 45 minutes before bed. Read a real book, not a Kindle book. Even if you have a light dimmer, read a real book, and have a nighttime shower, a bath, do some restorative yoga, even if it's 15 minutes for yourself, journaling, and then breathing deep while you're going to bed. So really starting the day ending the day with some self-care. And then throughout the day, now there is one great purpose that I think for using your smartphone for self-care. And that is you can set a couple of alarms. So set an alarm for like 10 in the morning and set an alarm for maybe 2, 3 in the afternoon and give yourself a 15-minute pause where you're just stopping, having a bio break, making sure you've gone to the bathroom, having some water, get some, tea, hydrate, getting off of the electronics again, doing some deep breathing meditation if you can, or getting a walk, but something, or just communicating with other human beings, not electronically, but real human beings. And so that is like really important, like having a pace for the day. And then I think the other really important thing to do, well, and that sort of assumes you're getting at least 7 hours of sleep a night. So you're doing that wind down and you're getting into bed. If you have sleep troubles, really working on those is important. But one of the things you can do is just stay in the dark. If you wake up, you know how people wake up and then they stress about being awake and then they stress about being tired the next day. Try to cut that loop. And one of the things we know from sleep studies is that it's not just the amount of hours you actually are asleep. That's really important. But if you can't get all those hours, 7 to 8 at least, but not more than 9, just make sure you're in the darkness, relaxing, doing your deep breathing, like a yoga nidra practice. Then the other thing that I think is really critically important is keeping our blood sugar balanced. So not scrimping on meals, not staying jacked up on coffee and granola bars or energy bars, but really eating real food rhythmically throughout the day. And so you're starting to get a sense there's a rhythm to your day. You wake up, you have a breakfast, you have a 10 o'clock reminder to kind of realign with yourself. You have your lunch, that's another reminder. You have a mid-afternoon reminder before the energy crash, that where you're really preempting that with some fresh air, some hydration. And then you have like a relaxed dinner where you're actually sitting, you're eating, there's a saying in Zen Buddhism, when you walk, when you eat, eat. So not doing a whole bunch of other things at the same time. And then you've got your nice evening and your evening wind down. And through the day, there's a steady rhythm and steady blood sugar. Now, patient and compassion fatigue is a real thing. And a lot of us if you're here at this webinar at Fullscript, it means that you're doing something that's a little different than the conventional medical practice is, which chances are means that your patient or client population are the very people that fell through the cracks in conventional medicine because there were no good answers for them. And sometimes that means those are the people also who have a lot more complex health conditions going on, a lot of mind-body stuff going on is often part of the picture because they have been dismissed by practitioners so many times. Their expectations of you might be higher, and also your expectations of yourself might be higher. There's a lot of pressure as an integrative functional medicine practitioner or whatever type of alternative practitioner you are, that you're the person's last hope. And I've had people come to me and say that to me. Mm-hmm. I've seen so many other people and you're my last hope. I mean, there's so much pressure on us. And then on top of that, you go to the latest functional medicine conference or the latest integrative conference or the latest naturopathic conference, or you pick up the latest book and everyone's cherry picking their best results. And they're not talking about the 30% of patients in their practice who never get better. And that can lead to incredibly high expectations. And people who go into healthcare are usually people who already have higher expectations of themselves. And so that discrepancy between reality, what's realistic to expect in a realistic time frame, and that pressure, and also a certain amount of being misled by people who are teaching at these conferences and cherry picking their best cases and saying, if you just do this, your patients are going to get results, means that you're going to feel like a failure, or at least that you're not good enough. And I mean, I've been doing this for 35 years and I still, sometimes I come home from something and I'm like, wait a minute, I'm not getting those, what am I doing wrong? So, being mindful of those external pressures and those stories inside your head, because those stories can be as exhausting as anything. And being mindful to set realistic expectations with your clients or patients so that they really feel like you're engaged in a partnership with them, not you're going to fix them by the third visit. Can really shift the tone for the relationship, remembering that you can't fix everyone and everything can be such a huge letting yourself off the hook, but it also creates more patient compassion for themselves. And that's really, really powerful and important. Taking a minute, even if you just go wash your hands or do a few deep breathing practice, 4 minutes of deep breathing, I don't know where that number came from, but 2 minutes of deep breathing between patients or clients. Because it's really easy if you have one really challenging encounter and then you go right into the next to kind of just trail that energy along. Sip some water, something that just kind of clears the energy. And then as much as you can, let it go at the end of the day. It's so much. I just read a study a couple of days ago that came through Medscape. Something like 70% of medical doctors are now saying that electronic health records have really put a damper on the quality of their patient care. And so many people are going home after a full day of seeing patients or clients and then first doing notes without taking any time off. So for me, like, you asked about how I do it. I really try to do all of these things. The other thing is I have a very sacrosanct on 2 o'clock on Friday afternoon, I shut everything down. So sometimes I do a little work on the weekends, especially if I'm writing a book, but 2 o'clock Friday afternoon, I'm done. There are no appointments, there's no notes, there's no charts. Do you want to know what I really do? I watch my streaming download episode of Grey's Anatomy that I've been watching. Someone got me into it the second year that it was on, so I had to catch up the first year. So once a week during the seasons it's on, that's my ritual. I watch my afternoon of Grey's Anatomy. I try to get outside. I have some chai tea or some kind of tea. And I know chai tea is redundant, so I have some chai. And chai means tea. And it's when I read something that I've been wanting to read. It's when I do handwork or craft work or just go on a hike or do nothing. Like I might journal or I might just veg and watch silly stand-up comedy on YouTube if that's what I feel like doing, depending on the weather. And having that time that is just for you and really, really making it sacrosanct. And the reason for that is not only is that time replenishing, deeply replenishing, but you look forward to it all week. You know it's coming. So it's like that light there that you can really rely on. A couple of other thoughts that I want to share are really knowing what your patient load needs to be or your client load needs to be for your economic and personal needs to be met, and not feeling like you have to say yes to everything and everyone. I'm very good at saying no. I'm a New Yorker. Like that's one good thing. I can say what I mean and mean what I say. And I'm really good at saying no and meaning it and sticking to it. And anytime I kind of edge out of that, I find myself reminded. I posted this thing on Instagram that said, your intuition. What is it? I wish I hadn't trusted my intuition, said no human being ever.
Yeah.
Like when we listen to what's going on in our bodies, when we know we've hit our limit, really stopping, not taking on too much at once. And one powerful practice technique or tip that I can really share with you also is having a niche. And as I said earlier, one of the things that I'm leaning more toward, right now, I'm trained in internal and family medicine. My internship's internal medicine at Yale. My residency's family medicine at Tufts. I'm a midwife. I'm an herbalist. So pretty much treating everything is truly in my training wheelhouse. But I can't keep up with the literature. I can't keep up with the medicine on everything. I can't keep up with the supplements on everything. I can't keep up with the new lab testing on everything. So for me, it starts to feel, it adds to that sense of inadequacy because I don't know everything all the time, or it adds to that sense of never ending. I've got to, even when I'm watching Game of Thrones or whatever it might be, Grey's Anatomy, I'm having that feeling I should be doing something else. And that is what I really want to not have inside myself. So finding a niche, and whether that is a large niche like women's hormones or autoimmune disease, or a small niche like fertility or preconception, or you treat 3 autoimmune conditions, or you just work with a limited number of dietary strategies in your practice because you're a nutritionist. Finding that sweet spot of what you really love actually is going to bring more patients or clients to you because you're going to start to establish yourself as a specialist, but you'll also be better, in my opinion, better at what you do because you'll know what you do really, really well, and you'll be less burnt out. So I think that's a win all around. All right,
Yeah.
big long answer.
Yeah.
Time
No,
in
I love
nature, hot baths, all those things. Times just breaking up laughing with my friends or my family or snuggling with my two grandkids. All of that is all what makes it work.
Yeah. And I think we've got to practice what we preach, right? Like we're
Yes,
always telling our patients like take care of your adrenals and like do all this, but if we're not doing it ourselves, then we're not setting good examples either.
exactly. Exactly. No, I feel like it's inauthentic for me to say something to my patients that I don't do. And if I'm saying something to my patients that I haven't tried to do, I think that's not fair because I might say, do this every day as a practice in your life. And then I try to do it and I'm like, there's no way I can do this. So walking your talk becomes important because it also helps you set realistic expectations of what your patients can actually incorporate in a protocol or your clients can incorporate. But it also makes you more compassionate when somebody says, yeah, no, I just could not fit in doing that diet diary. That food journal that you asked me to do, didn't get it done. So in my courses, one of the things I have my students do is a 3-day food journal because you really see it's
How hard.
not that easy to fit in a busy, full life. So,
Yeah, for sure, for sure.
yeah.
And then what about nutritional supplements and adaptogens? And you talk about using the adaptogen spectrum to help patients and even to help ourselves. Um,
Yes.
yeah, do you want to talk about that and explain why that's so important?
Absolutely. So, we all could use a little bit of extra help sometimes. And it's nice to think that we could get everything we need from food, but we all know that there are days that we skip a meal here or there, or, even if you're eating great, our food is not the same food that our grandparents or great grandparents were getting, right? You have to eat so many more oranges now to get the same vitamin C from an orange 50 years ago. It's ridiculous. So, sometimes when we've crossed over a line into not just a little bit of imbalance, where often then just getting some rest and getting some exercise and getting out in nature and getting better sleep can repair us quickly, sometimes we've crossed over a line into a little bit more disrepair. And that's where supplements can really come in. Now, I will say the adaptogens have been used historically for thousands of years preventatively as well. They have been used as tonics. So ginseng at a certain time of year would have been prepared and taken as a tonic. Or ashwagandha in Ayurvedic medicine may have been stirred into some milk with a little bit of honey and taken as a bedtime medicinal nourishing tea, not when somebody had something wrong, but just as part of a healthy lifestyle. And to some extent, we've become polarized where we think of our herbs and supplements as medications and our foods as sort of nourishment. But historically, cultures have always woven herbs into a daily lifestyle. So adaptogens can be used that way. But then think about them, what we're talking about here more restoratively. When we're under a tremendous amount of stress, or even just normal day to day, your adrenal cortex, the outer layer of the adrenals where cortisol is being produced, which is why cortisol cortex just means the outer bark, is producing cortisol. It requires B vitamins, magnesium. We use up a lot of vitamin C, believe it or not, in our adrenals. So if we're under more stress, we're actually plowing through those more quickly. So think about replacing or supplementing so that the body has extra of what it needs during those times of stress or while you're repairing. So think about magnesium, B complex, and vitamin C, ascorbic acid as part of a protocol for restoring the adrenals or supporting someone when they're under a stressful period of time. Phosphatidylserine has also been shown to be beneficial for replenishing and supporting the adrenals. The adaptogens are a class of herbs that term was first coined in the 1940s, and it was based on research that had been exploring the use of specific plants as in the then Soviet Union for improving athletic performance and getting more productivity out of workers. And part of what was seen is that, and this is a well-known phenomenon, that when people do high performance athletic events, so somebody's training for a marathon, they run the marathon. After the marathon, they're much more prone to this viral syndrome that can happen. So you push, then you get sick when you stop. And a lot of people have seen that in school, graduate school. You push, you're fine. You take your final exams, you go on vacation. Day 2 of your vacation, you're laid up with the flu or something. So adaptogens are a broad class of herbs that meet several definitions, one of them being that they don't address any specific body system. So they're not just for the liver, they're not just for the adrenals, they're not just for the stomach or the intestines, they're multi-systemic. And again, that is because of the impact that they have on cortisol regulation. And they're non-toxic, not harmful, which for the most part is true. There are some herbs that are adaptogens like ginseng or licorice that taken to excess or in certain people may have adverse effects, but they're not technically toxic. So adaptogens are used literally for exactly what they sound like, to help us adapt to stress. Now, that doesn't mean you can use adaptogens to override your stress level. Really, you want to think about them for supporting you or your clients or patients or repairing the damage that's happened. And what's really interesting is the studies on adaptogens. When you start to look at them, you see things, all these random studies, right? Like reduces herpes simplex virus outbreaks, improves oxygenation during exercise demands, reduces blood sugar or improves blood sugar levels, improves non-specific immunity, helps fight the flu. Like, how can one class of herbs do all these things? Again, it brings us back to that story about cortisol, which is it's impacting so many different systems. Now, adaptogens are, they all share core similarities in that if you look at the research on many different adaptogens, you'll find similar results: improving cognitive function, improving energy, restoring immune function, glucose regulation, insulin regulation, improved exercise performance, etc., reduced illness overall, and improved well-being. But within that spectrum, they have different sort of unique characteristics. They have unique flavors, if you will. So ashwagandha, for example, is really calming. I mean, it's so calming and so nourishing that it can be taken right before bed and has historically been used, as I mentioned, as a bedtime support for sleep and for relaxation. Whereas very few of us would probably ever think of taking ginseng right before bed. Now, interestingly, there are some Chinese formulas where it's used to calm the shen, which is the mind. So there are formulas where it is used for sleep, but that's in a large combination, often with many, sometimes 15 other herbs. But you get the sense that there's this very broad spectrum of how much they impact your energy. And sometimes I think in the US, we tend to think, I'm tired, let me push, right? That's what we do with coffee. But actually, if you think about it, if you're tired and you drink coffee, you feel energy for a little while, but you feel more of a crash after. And the same thing with using adaptogens that are overstimulating when you're really exhausted. What you really want to do is rest, sleep, and calm that system down. So in my patients, when they're coming in with a pretty high level of burnout, fatigue, and exhaustion, I stay in what I call the spectrum of adaptogens. I stay in the calm, gentle end of adaptogens. So things that are really non-stimulating and that tend to be more nourishing. So think about ashwagandha, but also think about the medicinal mushrooms. They're stimulating to the immune system, but they're not stimulating in a sense that they're providing more a boost of an immediate boost of energy. You get energy over time from restoring your energy. And then you think about the more stimulating spectrum of adaptogens. Obviously, you're thinking about ginseng, red ginseng, but you might be thinking about American ginseng, which is a little more cool and calming than red ginseng, than Panax ginseng, but still at that stimulating end. Even rhodiola. I mean, if you think about, one of the cautions for rhodiola is not to use it with people who have bipolar affective disorder because it can be a mood stimulant. So I think of rhodiola and the ginsengs at that kind of farther end of the spectrum of stimulating. So they're kind of blue and cooling down here, red and stimulating up here. And then in the middle, of course, there's some crossover, but in the middle, I think about holy basil, for example, is sort of one of those classic in the middle adaptogens. Maca kind of falls between that spectrum of a little bit more calming and in the middle. And so that's how I think about them. And I really, very rarely use the more stimulating adaptogens unless somebody is already feeling pretty robust. So if somebody's burnt out, exhausted, they have an autoimmune condition, I might not even start them on adaptogens. I might start with a mind-body protocol, some restorative yoga, nighttime routine like we talked about, And then think about just the supplements like the C, the phosphatidylserine, B complex. Sometimes even B complex is stimulating for people. Magnesium is a great one. Then maybe even after a few weeks or 6 weeks or 8 weeks or more, then add in some of the gentle adaptogens. I use the more stimulating adaptogens for people who are fairly hardy and robust and aren't typically dealing with fatigue, but they're your medical resident who's pulling all-nighters, or your nurse who works a night shift, or your airline pilot, or your high performance athlete who feels good but needs that extra support so that they're not tanking and getting sick, wants to keep that healthy glycemic level, and wants to have that good cognitive function and physical performance. So that's what I call the spectrum of adaptogens.
Yeah. And so what are your favorite adaptogens for the moms, the busy moms who are doing it all?
Ashwagandha and reishi are my two favorite, and then I usually combine that with holy basil, with motherwort. Sorry, not holy basil, with motherwort. Motherwort is my all-time. It's not an adaptogen, but it's my all-time favorite mom herb.
I like it. I like that
Yeah.
combo. And I think what you were sharing about the compassion we need to have for ourselves is so important right now. So I really think that that would be really well appreciated by all of our listeners. And I know I appreciated that as well. So thanks for sharing that.
You're so welcome.
And I think we're coming close on time. Was there anything you wanted to mention that we didn't cover already?
Oh my gosh, I feel like I don't want to overload people. So
So
if
much, yeah. Well,
anything else,
I
no, I can't think of anything else.
no, I have one question for you, kind of off topic, but what's your all-time favorite book that you've ever read?
In my whole life.
Yeah, like your favorite go-to, one that you could pick up again, or something that you learned.
So I think that probably my favorite book that I've ever read is Uncle Tungsten by Oliver Sacks. I'm a huge Oliver Sacks fan. I think the most important book that I've ever read is a book called Mindset by Carol Dweck. And it's such a powerful, game-changing book, um, because it really talks about how we frame our experiences in life as to whether we approach life as a judger or a learner. And I think when it comes to compassion fatigue, which a lot of times I think we get because we feel like we have to be everyone and fix everyone, and we're not, and we're judging ourselves, it can be really exhausting and really demoralizing. But even in life, whether it's that you're building an Instagram platform or building your practice to learning how to cook or learning a new skill, it's so easy for us to become non-compassionate with ourselves and judge ourselves. And so this mindset shift to how can I use this as an opportunity to grow, to learn something about myself, to enjoy life more, it's amazing. And in the book, she breaks it down for different professions too, which is really interesting. So she talks about the attributes of, for example, high performance athletes, or the attributes of highly successful musicians. And she looks at some of the commonalities. For example, among some of these world-class violinists, one of the most common traits that she discovered was not practicing all day and all night, but actually knowing how to hit pause and take a nap in the afternoon. Or she talks about how a lot of times as human beings, when we don't feel like we're optimizing our performance on something and we see somebody else doing it really well, we tend to assume that somehow they're genetically more endowed or they're better as a human being than we are, or that we have something wrong with ourselves. And so she uses examples of people like Michael Jordan, who, yes, I mean, certainly Michael Jordan is probably phenomenally endowed physically and with, hand-eye coordination. But what she really says is that not that he's an average guy who was an athlete, but she talks about his commitment to his craft and his commitment to getting on the court when nobody else was, to practice after a game because he wanted to hone a skill that he had seen or done. So it really takes away this idea of sort of like judging ourselves as being inherently good or bad at something, and just learning to, yeah, it's just a great book. It really is my hands down favorite book.
Awesome. And for me, like this is one of my favorites right now because I find for me recommending this to my patients has been able to and allowed me to save my patients money because they read this book and they get so much info about naturopathic philosophy and it's all encompassing. It really covers so many different things and at the back you've got so many great recipes for even us to try. You always get bored in the kitchen, need some new ideas. So I think there's some ideas in there and yeah, just awesome, awesome book. So great job. And I'm so looking forward to reading your next one as well.
Thank you. I'm so looking forward to it being done.
Yeah, I bet. Well, thanks for sharing all of that with us today. And I really want to give a special thanks to Fullscript too for putting this on and bringing us together to have this nice conversation. And a little reminder to everyone who's listening that the softcover version of this book has been released. So now the softcover is available. And for anyone who's interested in learning more about survival overdrive or the adrenal thyroid connection, you've also got the mini courses available for professionals to
It is, yes. It's like a 5-hour course with a deep dive on adaptogens, but also basically what I do in my clinical practice, approaching adrenal and thyroid.
That's awesome. So for anyone wanting more, they can always check that out at your website, right?
Yes, avivaromm.com/courses.
Perfect, perfect. And I follow you on Instagram. I think your Instagram feed is amazing. It's a good reminder to me to practice self-care. So for those of us practitioners out there who need that little reminder, they should probably check out you on Instagram as well. All right. Well, thank you so much.
Thank you for having me.